This is an example of what you can expect on the arm when you have thin skin, had a relatively large area removed, and you need to get a good result. In this situation, there's been a previous growth here that had to be removed. It was removed about 7 years ago, and now a second area has grown back. Point is that I've had to put in several stitches that are on the side. These are called pucker stitches because you can see that this area is puckered up. They're put in there to control bleeding and also to take up some space. Otherwise we would not get a good cosmetic result. Actually, on the arm there's no guarantee you'll ever get a good cosmetic result, but there's no harm in trying. As you can see, we've changed it a little bit. We have some extra stitches from the previous scene. These stitches go across the area where the wound edges are pulled together. So we have two different sets of stitches. Stitches that cross the line and stitches that actually go underneath the skin and pull the skin together, pucker stitches. The point is that the pucker stitches sometimes have to be removed early. They sometimes have to be removed a few days, a week early. It's hard to always tell when they need to be removed. Sometimes after the local anesthetic, I don't know whether you can see on camera this white area, but the local anesthetic has caused this. When it disappears, a lot of times this puckered area begins to flatten down and looks somewhat like this. That's good. If it doesn't, then that's not necessarily bad, but it does mean that maybe these stitches, the pucker stitches, need to be removed early. Again, it's not always clear, but usually it's estimated about a week on the arm is when they should be removed. If any of this area gets red, sore, or tender, well, the stitches do need to be removed because there's too much tension on the wound edges. So you need to call if you find places that are getting red, sore, and tender.
Sometimes Dr. Wesley asks patients to use an ice pack to slow down the blood flow as it returns to an area after surgery. You should use an ice pack about 15 minutes every hour when you begin to feel the numbness wearing off. That's usually a tingly feeling. To make an ice pack, we will give you a medical glove. For some reason you get out of here without a glove, you can use a Ziploc bag or any other ice pack you may have at home. You use crushed ice with 2 teaspoons of salt. That will make the ice very cold. And do not remove your bandage. You place it right over the bandage itself where the ice is. Hold it on for approximately 15 minutes, and if your skin starts to get a little bit cold, take it off. You can take it on and off during that 15 minutes. You need to do that every hour until bedtime, or until you believe the blood it's not bleeding or you don't think it's going to bleed. And you can usually tell through the bandage if there is any bleeding, and if so, and the ice pack does not stop it, you should call us and let us know at 824-7491 if it's after hours, and 822-0654. That's the nurse's line during business hours.